Have you ever had a moment when you clearly thought you knew where you had put something, only to find that it seemed to disappear completely a few minutes later? Or perhaps you noticed yourself repeating the same story, asking the same question again, or forgetting what you had planned to do. Just moments before these experiences can be frightening, especially when they begin to happen more often. Many older adults silently wonder whether these changes are just part of aging, or whether they may be early signs of dementia. The truth is that dementia usually does not begin all at once. It often starts quietly, through small changes that seem easy to dismiss. At first, it may look like simple forgetfulness, but over time the pattern becomes more noticeable. That is why paying attention early matters much more than waiting for severe symptoms to appear. Dementia is not only a problem of memory. It can affect judgment, language, orientation, emotional control, motivation, and the ability to manage daily life. Some people first show changes in recent memory. Others begin to struggle with directions, money, planning, or conversation. Some appear more withdrawn, suspicious, irritable, or unusually passive, because the early signs vary from person to person. The most important thing is not to focus on only one symptom, but to notice whether daily function is changing in a consistent way. One of the most common early changes is repeated questioning. A person may ask whether they already took their medicine, what day it is, or whether lunch has been eaten, even after hearing the answer only a short time earlier. This can happen when the brain becomes less able to store and hold recent information. Ordinary forgetfulness often improves when someone is given a hint. In contrast, early dementia may involve difficulty forming a new memory in the first place. Family members often become frustrated because it feels like they are repeating themselves all day long. But anger rarely helps calm repetition. Written reminders, visible calendars, and simple routines are usually much more effective. Another common change is difficulty with familiar routes. A person who has taken the same walk for years may hesitate unexpectedly, miss a bus, stop, or feel uncertain in a place that used to feel automatic. This can happen when spatial orientation begins to weaken. The brain is less able to create a mental map of where the person is and where they are going. In the early stage, these episodes may be brief, but if they repeat, they should not be ignored. Clear labels at home, simpler travel routines, accompanied outings, and emergency contact information carried in a wallet or phone can all improve safety. Losing objects in unusual places is another important sign. Glasses may appear in the kitchen, a wallet may be found in a drawer that makes no sense, or a remote control may turn up in a bedroom closet. The difficulty is not only forgetting where an item was placed, but also losing track of the action of placing it. Sometimes this confusion can lead to suspicion. A person may accuse others of taking things because the brain can no longer reconstruct what happened in such cases. Arguing over the truth usually increases distress. It is often more helpful to create one fixed place for important items, and to support the habit of always returning them there. Large labels, trays near the entrance, and consistent organization reduce unnecessary confusion. Changes in time. Awareness are also common. A person may confuse morning and evening, forget the date, dress inappropriately for the season, or lose track of appointments. Sleep may become irregular and the rhythm of the day may seem blurred. The brain depends heavily on routine and light exposure to stay oriented. That is why regular wake times, regular meals, daily sunlight, and stable evening habits matter so much. Morning. Light tells the body that the day has begun. Predictable meals and walks help structure time. Too much late night, television or phone use can make orientation even more difficult. A quieter and more regular daily rhythm often supports better cognitive stability. Difficulty. Finding words can be another early clue. A person may know what they want to say, but cannot bring up the right word at the right moment. Conversations may become shorter and less precise, with frequent use of vague phrases like that thing or that person. The flow of speech can slow down and following long explanations may become harder. This does not only affect speaking. It can also affect understanding reading aloud, summarizing a short sentence, naming objects around the room, and maintaining regular conversation are all simple ways to stimulate language pathways in the brain. Even brief daily practice matters because conversation is one of the strongest forms of mental activity. Trouble with calculations, bill payments, recipes, and medication schedules may also appear. A person who once handled money confidently may make mistakes with change, forget payment dates, mix up steps in cooking, or take medicine at the wrong time. These difficulties often reflect a weakening in executive function, which includes planning, sequencing, organizing, and checking one step against another. Daily life becomes harder not because the person is unwilling, but because the brain is less able to manage multiple steps smoothly. For this reason, it helps to simplify daily systems, automatic payments, pill organizers, phone alarms, limited cash, and trusted support for major financial matters. Can reduce risk and stress. Emotional and personality changes also deserve attention. A person may become more irritable, withdrawn, suspicious, passive, or uninterested in activities they once enjoyed. They may stop bathing regularly, avoid social contact, or spend much of the day sitting without motivation. This does not always mean dementia, but it can be part of early cognitive change. It may also overlap with depression, chronic pain, or hearing loss. Hearing deserves special attention because reduced hearing often leads to social withdrawal. When conversation becomes difficult, many people begin to avoid it. As social interaction decreases, the brain receives less stimulation, and this can accelerate cognitive decline. That is why hearing evaluation and appropriate hearing support are important parts of dementia prevention. A hearing aid is not only about louder sound, it helps the brain stay connected to voices, language, and social life. Prevention matters because the brain often responds to daily habits, long before severe disease appears. One of the most valuable habits is observation. Simply keeping track of repeated questions, lost objects, confusion about days, trouble with speech, walking time, social interaction, and sleep can reveal patterns much earlier than vague worry alone. Written notes are often more useful than memory when trying to understand whether something is truly changing. It is also important to know that sudden severe symptoms such as abrupt speech, difficulty, facial drooping, or weakness on one side may signal an emergency such as stroke. Rather than slowly developing dementia, in such cases, urgent help is needed immediately. For slower changes, however, lifestyle becomes one of the strongest protective tools. The brain needs stimulation, circulation, structure, and connection. Reading, writing, simple puzzles, naming activities, singing, conversation, and learning small new things all help keep neural pathways active. These do not need to be formal or difficult. Even reading a newspaper headline aloud and explaining it in one sentence can provide useful stimulation. Walking is another powerful habit. It supports blood flow to the brain, improves mood, stabilizes sleep, and encourages orientation to time and place. Even a short daily walk matters, especially if it is done outdoors. In daylight, movement does not need to be intense. It only needs to be regular. Food also plays a role. The brain is affected by blood pressure, blood sugar, and vascular health, so regular meals with vegetables, fish, beans, eggs, nuts, and enough water support a more stable internal environment. Excess salt, excess sugar, and heavy processed foods can work against that stability. Sleep is equally important because the brain depends on rest to recover from daily strain. Regular bedtime and waking time, limited late evening stimulation, and a calm sleeping environment all help preserve cognitive function. Social contact should never be underestimated. A conversation with a neighbor, a phone call to a friend, a community class, or shared laughter during a simple visit can stimulate memory, language, emotion, and attention at the same time. Social isolation does the opposite. It quietly reduces the number of mental and emotional challenges. The brain receives and makes decline easier to miss. Pain and low mood also need attention. When knees, hips, back, or shoulders hurt, people walk less and participate less. That reduction in activity affects both mood and cognition. Depression can look like memory loss and can also worsen attention and motivation. That is why treating pain, recognizing sadness, and supporting emotional health are part of cognitive care, not separate issues. Regular checkups remain important as well. Blood pressure, blood sugar, and cholesterol all affect brain health, especially in older adults. Looking after these conditions is part of dementia prevention because the brain depends on healthy blood flow and metabolic balance. In the end, Dementia prevention is not based on one secret method. It grows out of a pattern of daily protection, observing early changes, staying mentally active, keeping routines steady, moving the body, sleeping regularly, protecting hearing, maintaining connection, and reducing unnecessary stress. For families, 1. Reminder matters, especially do not try to win. Arguments about memory errors in recall are often less important than the fear underneath them. Gentle tone, short sentences, one instruction at a time, and emotional reassurance usually help more than correction. Dementia is a serious condition, but fear alone does not protect the brain. Attention does. Paying attention to repeated questions, to changing routines, to reduced conversation, to unusual mistakes, and to emotional withdrawal can create the chance to act earlier. And early action often means slower decline and better quality of life. Even today, a small step can matter, a little more sunlight, a short walk, a phone call, a written reminder, a fixed place for essential items, or a more regular bedtime can all support the brain. More than people realize, memory does not protect itself automatically, but the brain often responds when daily life becomes less chaotic and more supportive. This is why it is not too late to begin. Protect the rhythm of the day. Protect the connection between people and protect the quiet habits that keep the mind awake over time. Those ordinary habits can become one of the strongest ways to help the brain stay present, steady, and involved in life.